A very warm welcome to my channel. This is an update on COVID-19, and as you guys already know from the thumbnail, I'll be touching base on the virus, its spread and the treatment. This is going to be a short video. If you guys want to continue watching, please do not forget to subscribe also at the end of the presentation or during the presentation. So the virus, the SARS-CoV-2, which is a pandemic which has hit global, which has affected the whole world. I want to make sure that I completely make you understand what this virus is doing in the body. So basically, this is the virus and this is the cell. So the virus is going inside the cell and telling the cell that I need a few copies of this gene or DNA. So there is, or actually this is an RNA replication. So the cell doesn't know, and the cell is doing whatever is told by this virus. So they are copying the gene in an extraordinary fashion. After this cell is filled out with the RNA replication, the virus is going to the next cell, and gradually the virus is taking over the whole body and almost all the cells of the body, and is telling us to replicate in a fashion that we can suppress our immune system completely. So basically the virus, which starts as just a nasal congestion, as a headache, sinus pressure, quickly is taking over the lungs, and then it's just, there is no end to this. And the tests, unfortunately we are short of the kits and stuff, so we do not have any testing means, at least for Florida I know. We are only testing extremely sick people who are on the verge of respiratory distress or going to be intubated. However, I do want to mention about a French study which came out in the international journal. Being an internist for 20 years, I'm an avid reader, and I believe in studies and journals. So this was reported in the Journal of Antimicrobial Agents. This was a French study. 30 people were enrolled for the study. Now, apart from this French study, there were several other studies that were done in China for the same thing, and this was involving a drug which is a very old drug. This is probably a 70 to 80-year-old drug I use all the time in my practice for people who have lupus, who have rheumatoid arthritis or things like that. So this is a drug which is very familiar to all of us. The name of the drug is called Hydroxychloroquine. It is a similar derivative of chloroquine, and this drug was used with a medication which is antibacterial, and exactly we don't know why a medication this with the antibacterial medication Azithromycin, which is also known as Z-Pack commonly, is being cutting down the symptoms and the transmission of the virus. So in this particular study, 30 patients were taken. They were randomized to people who did not take the medication and people who took the medication. Now a lot of these patients had symptoms, a lot of these patients had mild symptoms, a lot of these patients had moderate or severe symptoms. At the end of the study, what they found was people who received hydroxychloroquine, commonly also known as plaquenil in a lot of countries, and azithromycin or Z-Pack known, the combination of these two drugs was able to calm down the virus, decrease the amount of symptoms, and also these people were followed through and they were feeling a lot better quicker and actually recovered sooner than people who did not receive the medication. As I said, this is an experimental study. Please talk to your doctor to find out more about this disease. and the treatment. This is not a proven treatment. This is just an experimental drug, an experimental trial that was done. It was released in the international journal, and because there is other supportive studies that were done in China using the same two drugs, this seems to be promising, and we might be close to finding some sort of an answer towards this mammoth virus, which we do not even know how much of the virus inoculate is necessary to cause the disease. I hope you liked watching. Please do not forget to hit on the like button, and if you want to subscribe, please make sure you sign so that you can be notified for the next update on COVID-19. Thank you so much again.